Good morning, Dusaga. Good morning, Naki.
Good morning, sir.
Morning, baby.
Good morning, sir.
Yes, just 3-4 minutes more because I think still 10 people are supposed to join. Day 3 and 7 people are still absent. This is so you are joining from your home. When you have to go from your hostel to the lecture theater, how you will manage? Okay, without wasting the time and those who have joined in time, good morning and welcome to day 3.
Morning, sir.
Good morning,
Good
sir.
morning,
Good morning, sir.
Morning. I
Good morning,
hope,
sir.
yes, because yes. You must have had an interaction with Dr. Raquel regarding, there's no ragging in this college, there's no specific dress code in the college, but with due respect to the profession, we have to have a formal dress all throughout. The day one you enter the college and day you finish your internship. I guess you see me, this is day 3, you are viewing me, right?
Yes, sir.
Yes, sir.
And today also I am taking it from my residence. And I will go for another meeting. 3 days I'm out of the institute for doing central government's work on tuberculosis verification in different district. I'm sitting in my home. What dress code I'm following? A formal dress code, right? I can't.
Yes, sir.
This is our profession. With due respect to all the religions, doctors don't follow any religion apart from his being a doctor. Please bear it in mind, point blank. There is no religion for a patient. There is no religion for a doctor. We are all doctors and human beings. That's it. There is no caste. There is no poor patient, rich patient. Patient is patient. Doctor is doctor. Or if you see, if you have not seen the movie called as the Hindi movie, Munna Bhai MBBS in 2003 got released. It was shot in one of the medical college where I studied, Grand Medical College of Mumbai. And see the dean and the dialogue of the dean. So yes, we have to maintain the professional hairstyle should be short and trim. For girls, it's neat and tidy. No fancy things. You know, in medical profession, when you are a student, you're not also to have your nail polish, no lipstick, no earrings, minimum jewelry, if at all you are having. No long hairs, boys, no long hairs, clean shave. If you're maintaining a beard, that has to be very, very neatly groomed. Shoes should be very formal. That is the way you discipline yourself. You will carry forward the same image to the patient. No smoking, no drinking in campus. Yeah, so that madam must have told you. So those are subtle nuances. If you Google it, dress code, mostly the dress code is given in All India Institute and other institute. If you Google, there will be a very clear-cut guidelines what a medical student has to abide to. Okay, that's apart. Today's session, I'm going to start with what we have been, you must have been hearing that I've been saying there's a new curriculum, new curriculum, new curriculum. The books remain same. The books remain same. I urge, there are how many people of there? 71, 2 is Zoom, ZMC Zoom, and 1 Dr. Manoj. Please have almost all the books from the international authors.
Okay, sir.
Because they'll give you a perspective. What happens when an Indian author writes, he tries to simplify in terms of students' understanding, but then there is a dilution of the content of the medical, what you say, the medical content is diluted. That is just like you're writing an exam. You are not here to write an exam and pass. You are here to learn. That's what the entire curriculum is talking about, competency based. So you have to become a competent so as to serve the community and get the maximum benefit out of it. That's why this is termed as the competency based medical education or curriculum. Of course, this is the outline what we are going to see. See, I would have had a two-way dialogue just without a PowerPoint presentation, but I thought because there are some technical terms, I would like to use them. Probably today's afternoon also, doctor's role. Unfortunately, Dr. Lua is not able to take this session for various reasons. I will be taking the role of doctor in the society. So we'll just see definition of what do we understand by competency. But before I could say what is competency, can anybody tell? Mingsangi, what do you understand by competency? In general term, don't think about the medical terminology and jargons. Just what do you understand when we are talking competency, Mingsangi?
Maybe just the ability to do something.
Very good. Naki?
The knowledge and skills.
Knowledge and skills. Very good. Vikas?
Sir,
Hmm.
I don't know, sir, much about it.
Okay, pass. That means Mary Jones will talk. Mary?
Yes, sir.
What-
Ability to do something efficiently, I think.
Efficiently, right? Yes. So somewhere you are all Naki, Mary, and Mingsangi. I think because if you have heard them, yes, we have to have a dialogue. I'm very glad all of you, even Vikas, you boldly said that I don't know. Yes, I don't know is very important in life.
Okay, sir.
And I'll tell you the Mizo word. Mary, please correct me. Kashilo.
Kashalao.
Yes. So Vikas learned this first word today itself. Mary has said Kashilo. I don't know. Is very important. If you don't know, then you go and ask what you should be knowing. Right?
Yes,
So
sir.
thank you for opening up. Please open
Okay,
up
sir.
whenever your classes are there. All of you should ask the faculty, sir, I did not understand this. Can you make me understand again? Mary might understand in one go. Naki might understand in two time. After two time, Mingsangi probably before teaching only she has already read and she knows. And because you can always say, no, sir, you show me, I will do it, then I will understand it. Okay. Yes.
Okay, sir.
Yeah. So what do you understand? Yes. What does the idea, if you Google what is competency? Yes. 100% right. All ladies goes to the cup goes to the ladies. Yes. Ability to do something, ability for a task. Right. That's a colloquial definition, or when we are chit-chatting over a cup of tea, we are just saying, okay, ability to a task efficiently, as Mary had said. Yes. So, but what is the bookish definition, which has got little longer, but it's got deep meaning? If you're not focusing on your screen, but I'll just read out for all of you. A competency is a habitual thing. Habitual, meaning every time you do it perfect. For example, as I was saying, that you go to a two-wheeler repairing shop And if he's not able to take a puncture out of your tire, he's not competent. Will you give him money still if he's not able to take puncture out of your two-wheeler?
No, sir.
Yes.
No,
So similarly, in our profession also, we need to be competent enough. We should be we should be doing it repeatedly, so that we get perfect. And judicial use of communication is very important. I told you that the curriculum has started with attitude, ethics, and communication. A patient comes to us and we all are glued to our the electronic device, which is the mobile, right? Everybody is on mobile and WhatsApp and chatting. Arey Baba, patient has come to you. We have to communicate. We have to understand what is the complaint which he has and elevate the complaint, treat the complaint. See, I'm telling you, you will remember me more than 2/3. Remember me in throughout your life. 2/3 of the diseases are psychosomatic in origin, meaning they come from brain. It's my thinking, oh, I think, see the entire COVID pandemic, I think I've got fever. Go and test. I think I'm going to get cold. That means it's COVID. Go and test. Oh, I have body ache and fever. Go and test. And you are coming positive. I myself got tested positive twice, staying in the campus. Oh, nothing, no big deal. My wife, who's the head of the Department of Community Medicine, unfortunately, she's traveling because of some urgent matters at the family. So she has gone to Mumbai. Otherwise, she would have been taking one of the sessions. She was also positive for one. So we all, almost 30-40% of the ZMC doctors were positive because we are treating patients. We are attending meetings, and we don't have to get scared of COVID. COVID is just another virus. Yes. So you have to communicate. Habitual practice and judicial communication. As somebody was saying, knowledge. Yes. Competence means acquiring a knowledge, technical skills, clinical reasoning. As I was saying that, yes, we have to reason out when you're learning any bone or any muscle, any organ, you have to correlate it, what disease it produces, what changes happen to that bone in a disease, how to how does it presents, what diagnose it, meaning what investigations you will do, whether blood investigation, X-ray, whatever, and how do we treat it. So it has to a continuum approach, meaning from A to Z, we need to get into a nutshell everything. At the same time, we have to be very empathetic about the patient needs, emotions, confidentiality. There are so many diseases where we have to also have patient confidentiality, especially human immunodeficiency virus, HIV. We have to have ethical values when we are talking to other colleagues, dealing with nursing staff, dealing with Group D who are cleaning. And at the end, we have to reflect, what have I done? When did I get up? What was my task today? So you have to plan your day every day, not only in medical education, but since you are now entered in the profession, throughout your career till you die. Reflect what I did in the plan in the morning and reflect in the evening. What did I do? So I forgot to tell you, all of you, those who are attending this, we want a written script. What did you learn? in the 2 weeks time. Mind you, somebody note it. If you, I am not in the WhatsApp group, I will ask who can take the lead, create a group. I will share my mobile number because we are also there in the first MBBS. We will need your group as the community medicine group, WhatsApp group, where I will be asking you, you can submit your reflection. What did you learn? And I will request that you write your reflection consulting at least 2 to 3 individuals, so that it becomes a group activity. See, when you will learn how to behave in a group, you will learn how to work in a team. When you do operation, there are 7 to 10 people in the operation theater. They work as a team. There may be nurse, there may be OT attendant, sweeper, anesthetist, physician, surgeon. So many people are there. So these all things become competency. And at the end of all this activity of habitual, judicial, knowledge, technical skill, reasoning, emotion, values, and reflecting ourselves into our practice for benefit of one individual as well as the entire community, because we are viewed as a white-collared profession. We are viewed as a topmost profession in the community in this planet, on this planet. Okay, so we have moral obligations to serve the community with compassion, empathy, and of course, the first thing, technical skill. Without technical skill, please, if you don't have technical skills, leave the course. You will achieve over a period of time. Everyone, now that I am confident you have entered the medical college, you will definitely become competent over a period of time. So you saw so many things we have to see in a competence. So possession of knowledge, skill, and attitude is the base of competency. You have correctly stated, you stated 2 things. I added the attitude here. Yes, we have to have a right attitude. As I talked from your dress code, people look at you from distance, and then the respect should come automatically. So we have these 3 bases, that knowledge, skills, and attitude, and it requires one to apply these abilities in the clinical environment to achieve optimal results. I was seeing, I can share one example. I was working as a senior resident in Tata Memorial Center in Mumbai, in Department of Preventive Oncology after my MD. I saw a patient and shouted at him that you're using too much of tobacco and you have this lesion in the mouth, you will die. So I'm sending you to the surgical OPD so that they can remove this swelling. Okay. So he went, and I told him, report me after what the surgeon says. He went to the surgeon. It was lunchtime. So he said, come after the lunch. So he came again to me. Sir, he has asked that come after the lunch. Also, I told him, okay, you also have lunch. So he went outside to have lunch in a hotel. Yes, Maria, anything? You're also hungry, want to have lunch? Yes, okay. What do you mind your mic? Yeah. So this guy, the patient went to have lunch and he saw this doctor nicely smoking in the hotel. He didn't have lunch. He just ran and come to me again. Sir, you said you were shouting me at because of the excessive tobacco. I have this almost precancerous lesion, and you sent me a doctor who himself is smoking. What impression he gets? Just this is a live example I'm giving you of a patient. That is why we have to have a right attitude and right place. If unfortunately that doctor has to smoke, he should have gone to the smoking lounge or is sitting in his room or wherever, not in the campus. Unfortunately, yes. So apply the knowledge, skills, attitude for the clinical environment for the optimal results is a competency. Yes. And that is competency, but when will you get a level of competent? A student, medical student who has developed all these and demonstrated, mind the word demonstrated, shows and performs, then only. In the exam, you'll say, oh, I remember, sir, last day, you'll say, lot of meme videos are there in the YouTube channels and all. You'll say, oh, sir, it's coming, it's coming, it's coming. When it is coming? In exam, you have very little time to show your competence. So we have to be very means knowledgeable that you have only 5 minutes to show whatever is going to come. We talked about knowledge, skills, attitude, abilities. And we said we have to develop and demonstrate. But how can one achieve this competence among the students? Yes, this is a very famous pyramid. Not the pyramids of Egypt, but almost like them only. There's one scientist called as Miller, M-I-L-L-E-R, and this pyramid is after him. Miller's pyramid. Know this for lifetime. See the base of this pyramid. Maria, are you able to see this?
Yes, sir.
Yes. So we are talking about what levels, when we say that you are competent or a student becomes competent. The base is the knowledge. So you go on reading, go on meeting your faculty members, fact gathering. So you have to gather facts. See, medical knowledge is changing we did not know. I had read about coronavirus, but how does it, what vaccines and how it has, the knowledge has come in last 2 years only. But as you see, we have so much of complex body. We need to gather fact gathering. Each 800 billion, we have 800 crore population across this planet, more than that. So and every individual is biologically different. Interesting, isn't that? So we have to keep gathering the facts about the disease and the human being. That's the base, Then when you gather the fact, you try to interpret what does it mean? Or how do I apply? So the second level of competence is knows how. So when you read from the books and when you come for an exam, very little we have to ask about what do you know about the things. We always ask you knows how, what is the application of your knowledge, or how do you interpret it? This is in exam, theory exam, where we would like to ask you, how do you interpret an application? So even if you read, as we were in my first class, I was talking, yesterday I was talking about vitamin A. You need to know all the fruits, whatever in the planet that gives vitamin A. And how do we apply it? Meaning, what is the how we can consume it and how it is going to achieve or remove the deficiency of vitamin A. That's what is application. Fact gathering is, yes, you will know vitamin A is causing night blindness. But what are the fruits which can change? How are they digested? How will they remove the deficiency? That's what knows how. That's what a doctor's job is. Then next comes as a student that you perform a practical, demonstrate your learning. Right? Demonstration of the learning is in practical. That is where we say, then you are competent. Without just knowing and you are able to do knows how that interpret, that does not mean you are complete. So if you copied the link which I shared yesterday, some of you copied the link.
Sir.
If somebody has copied, put that in the group, your WhatsApp group. Those are modules of curriculum, and you click the first curriculum, first module only, UG curriculum volume 1. That is where you'll find anatomy, biochemistry, and physiology. And you click on volume 2, where you will find community medicine, which is also being taught in the first year. We will be teaching you throughout 4.5 years. Then the shows how that you show in front of a teacher or in front of a demonstrator. But when you do independently, the topmost, the apex, no, apex of the pyramid, tip of the pyramid, on a patient, this is in practice, this is on patient, and doing without any supervision. That means you are doing on your own. Suppose you learn how to do injection as it shows how, but you perform on a patient without anybody in an internship, or sometimes even at your MBBS level, first MBBS, second MBBS, anything, you are able to perform. So you are taking blood pressure and you are taking blood pressure of your colleague at your hostel without anybody's supervision correctly. That means you have achieved that competency. Okay, so these are the 4 levels of competency. The base is knowledge. You have to gain the knowledge. Then you have to have a right interpretation of the knowledge and its application. Then demonstrate that learning in a practical, and then perform with supervision or without supervision. Then you are achieving highest level of competency. There's another model of stages in learning. One of my colleague, I think, Dr. Lalmangai Zuali, Eliza, or we fondly call her Elizabeth Betty, Dr. Betty. She's going to take you through learning processes. So she might repeat some of these competency models, but since I'm talking the base, what is CBME, and I think this is important, that when you are learning at the beginning, you know that some people were, as I gave you an example of, I always feel that mechanic, two-wheeler mechanic or car mechanic, it's one good example to understand, relate rather, because it's day to day we do. So somebody who's under him working is a novice fellow, then he become advanced beginner, then he becomes attain all the competency, that is without maybe with supervision, and proficient, and without looking at it also he is able to do it. No, you'll see some of the nurses they talk to the patient in their eyes and they're giving injection on the other side. They're proficient. And masters, perfect, super perfect. So these are the levels of skill learning. If you see the x-axis, it depends on time, practice, patience, and experience. Over a period of time, you achieve one day, otherwise the course would be. Yes, the same thing. And everybody to be expert, no? Some people will just say, oh, I want to know Dr. John only. No, I can't come. Somebody else is sitting today. Okay. But now with this particular curriculum now, that everybody is going to be competent, that everybody will be at par. Nobody should have a favoritism that, okay, Dr. John's OPD, they want to attend. I'm just giving an arbitrary example, okay? So anybody sitting on that day of OPD will be competent because they have gone through the CBME curriculum. Because competencies are developmental, okay? They are processed. And expertise definitely changes over a period of time. I don't want to get into all this. These are more jargonish slides. This is also very intrigue four-square model, where when you have unconscious competence and conscious competence. Lom Sangzwale, good morning. So you have, when we say that you are competent, consciously, in the beginning you are incompetent because you don't know, you acquire knowledge, you are not aware of the skill. Then you get hold of the skill, so you become aware, conscious, incompetent but conscious, that you are aware of the skill. When you read, you see, okay. Then when you actively start working on the skill and you're working, your mind and heart is working on the skill, you are consciously competent, performing when your teachers are there, and then teachers saying, okay, good, this time. And when you are unconsciously competent, you are so skilled that you don't no longer require anybody's guidance. Just a minute, I have a call. I'll just take a call. Hello. Oh, good. I'm so sorry because I'm traveling tomorrow. Early morning. Yeah. So you got this grid. When you are incompetent unconsciously because you are not knowing the subject or the knowledge. When you get the knowledge, but you're still incompetent, so you are consciously incompetent. You are consciously competent because you know the knowledge, you know how to do it in front of the teacher, demonstrator. And when you do, when you're, as I said, I gave an example of, you're reading a blood pressure measurement and you're doing it at your home also, like you learn in here in medical college, what are the different steps of blood pressure measurement. See, currently in COVID, we all are actually, misguided by the concepts of medical field. We are all using the digital blood pressure measurement, which is wrong. Okay, so you have to have a either a dial BP instrument, that which is also called as aneroid blood pressure measurement, or you have a digital other one where you have to inflate it and make a reading. You have to put a stethoscope and it. That's a good one. We have it in physiology. Don't worry about that. Yes, this is again the same thing which we were talking about, levels of competence. From the bottom, if you see, K is knowledge, KH is knows how, S is shows, SH is shows how, and P is performing. Don't go into the other words. I just wanted to know this K, KH, S, SH, and P. So if you open that competency booklet in the web address which I gave of NMC, you will see the competencies are written, and a level of competence which is required is also written there. Is it clear up to now? You will say yes only. I know. On this online interaction, we are hearing from 2 years is the same. So we don't want you to remember or everything, but when you are writing your reflection, we will require your reflection on 28. 28 is Monday, February 28. Okay. So what I suggest is you draft a paragraph of the activities, 2-3 people together, and I will send you an email address on the last day. I'm taking the last session also. I'm taking on career pathways in medical student. That time I'll share you the email address. By that time you start preparing, but Joy. Okay. So the next one in the competency is what do you understand by goal, and what is competency and what is objective? Anybody?
Sir,
Lal Longliana.
Yes, sir.
Yes, what do you understand by goal? Don't say talk about the football goal, okay? Huh?
Okay, sir. Goal. What we have to achieve.
Then what is objective then?
Objective. Sir, I cannot clearly say that.
Okay, good attempt, but Emily?
I think goal is a desired result and objective is an aim.
Very good attempt. Yes. So goal is a projected state of affairs that a person or a system plans to achieve. Oh, yeah. Wait. Little bookish, isn't it? It's from the published article only I'm taking. JAMA, if you see the bottom line, JAMA 202, 2002. Yes. Why we are writing this, JAMA 2002? This has got a meaning. It is the professional way when you, from where you have taken your content has to be depicted. Medical profession is not just, as I told you, white collar profession. You have to be very etiquette, good looking and all. We are legally bound. Unfortunately, our profession is legally bound. So what you talk, what you write, what you show should be there with an evidence. Mind you, evidence is very, very important. So what you quote, this is an example which I'm sharing. I purposefully put this article down, that from where it is taken, because every statement you have to say that this is from there. Of course, not in your writing exam and you're writing answers. You don't have to quote Guyton page number 23. If you write this, you're master. One of my senior colleagues used to do that. Gray's Anatomy. In the answer, he'll write Gray's Anatomy, page number 726, para 6. This is that. Photographic memory. Anyway, so goal is a projected state of affairs. So I will say my goal is to become a millionaire. Or my goal is to become a renowned cardiologist. Then what competencies I need to know? If I say cardiologist, an observable ability of a health profession integrating multiple components such as knowledge, skills, values, and attitudes of all cardiologists. I need to know knowledge, skills means certifiable skills, not only skills which I'm able to do. Somebody, a third party has to certify, yes, this skill is perfect or graded skill. You know, when you go to US, they'll ask you CGPA score. When you are writing plan, you need technical skills are there, graded is required. So that competency has to be there. Of course, value and attitudes follow the same thing. So that is a competency. And Emily, I think you said right. It's also objectives are also called as aim. Sometimes we say aims and objectives. A statement of what a learner would be able to do at the end of a specific learning experience is an objective. So objective feed to the competencies and competencies will feed to the goal. So goals are idealistic. As I said, broad, I want to be a billionaire. Oh, I may not become a billionaire. I may not become a #1 cardiologist in India. But they are idealistic, broad, sometimes vague. You know, everybody, I come from Mumbai where everybody wants to come in a film industry, want to become Amitabh Bachchan. I also wanted to become Amitabh Bachchan. I don't look like him. So, yes. So, but that's my goal, maybe my goal. No, if I walked to that path, I would have done something somewhere small. So they are idealistic, broad, vague, but general intention or observations are there. Yes, because you raised, you want to become Amitabh Bachchan?
No, sir. Sir, I want to ask,
Please go ahead.
what is vague?
Vague means little offshoot. Isn't it vague that I want to become Amitabh Bachchan?
Okay, sir.
Vague hai, matlab,
It is like goal.
A goal may be vague. Means
Okay, sir.
I might say, no, okay, I want to become, okay, Tom Cruise.
Yes, sir.
It's a vague only. See,
Okay,
but
sir.
when we are thinking in terms of learning, as the second example which I gave, okay, I want to become #1 cardiologist. I may not become #1. That's also a little vague. But I'm thinking of an idealistic condition that I know everything of cardiology, of the heart.
Yes, sir.
Sometimes it is abstract, difficult to measure. How I'm going to be a billionaire? Am I Adani or Ambani? No. Am I Bill Gates? No. So, but if I have a goal that I want to become a best doctor, so what is it that I need? So I need a competency. Secondly, if you see, which are achievable and measurable. Not measured by you, measured by a third party, measured by a independent body. Inge, Jwali, mute to. Yeah, thank you. Then, so competencies has to be achievable and measurable. Then the objectives, they will be narrow and precise. The downs, okay, I want to learn the cardiac cycle, the cardiac anatomy, and the various diseases of the heart, their presentations, the investigation and management. So they become, the objectives are very narrow and precise, and they are actually derived from the competency only. They are not abstract. They're concrete. You learn more and more when you learn these competencies. So I just give an example here of goal, competency, and objective as a medical student. No, okay. The goal is produce a skilled basic doctor at the internship. Okay, so you are a skilled basic doctor at internship. That's our goal. Then the competency, what we have to achieve here is the student is able to manage common diseases in the outpatient OPDs, outpatient department correctly. And main thing is able to perform basic procedures correctly in the trauma care. And thirdly, able to demonstrate effective communication skills when you're talking to the patient relatives, or your team members. So these are the three competencies which we are looking at when we are thinking. This is just an example. This is my last slide. I'll be stopping now. So the goal was very broad. You are becoming a skilled basic doctor at the end of your internship. Mind you, in internship also we have skill certification for you all. So this, I just gave an example, three competencies we are looking at when we can call you a basic doctor, skilled, that you are able to identify and treat and manage common diseases in outpatient department. You are able to perform some basic procedures which are acute in nature, that means emergency care. And you are able to demonstrate also communication, whether you are able to effectively say this is wrong or this is right. Okay, so this was competency. Go to the yellow boxes or the white boxes you are saying. So to achieve these three competencies, you have able to describe a different types of diseases. Second, able to diagnose different types of diseases by a physical examination. So you examine and say correctly that this is a particular disease, and you are able to provide basic first aid to the patient. You are able to plan basic investigation, what you require, not all, but investigation means you want to test the blood, you want to do X-ray of the chest, or you want to do sonography, or you want to do a CT scan, something like that. Then fifth thing is you are able to counsel the family members of the patient. And finally, if you are able to identify the need for a referral, suppose this case is beyond your management or it requires higher technical setup, then you send to a higher center. Okay, so that is the main thing where we are thinking a goal can be achieved. So goal is a broad, then there are set of competencies which are to be achieved to go towards that goal, and to achieve these competencies you have objectives to be fulfilled. Any question? Hello.
No, sir.
Is it clear? To some extent, of course, this is, we are just talking superficially now, but we are just giving you on concept why we are saying this curriculum is competency based. What are we supposed to do? You get this example at the end of your curriculum when we see that you want to be a skilled basic doctor, and you have, these are only just example of competencies which I have gave. There may be more than 100 competencies which we have to do. Every subject has more than 300, 400 competencies. At the end, I think you will be having 10 to 20,000 competencies achieved. Yes, I'm not joking. We have more than billion cells in our body. We need to know all of them. We need to know all of them, what they function, how they regularly maintain their, how am I talking, how am I having breakfast, or how it get digested, the defecation, the urination, the respiration, thinking, all these cells, how are they normally behaving? When I have a disease, how the cells behave in a disease, how to do checking or investigating my status, whether normal or abnormal. Then what are the signs I will have? What symptoms I will have if I have a disease? And how do we basically correct these diseases? And what you can communicate to the patient or relative. This is in nutshell the skills and competencies which you will be going through in 4.5 years and 1 year of internship. That means 5.5 years. That time we'll say that yes, you are the completely skilled basic doctor. Loud and clear.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, have a nice day ahead. I'll be seeing you at 2 o'clock. Role of a doctor in a society. Okay, thank you so much.
Kalome, sir.
Thank you, sir.
Oh, somebody said
Thank you,
Kalome.
sir.
Yes,
Sir,
yes.
Kalome.
welcome. Somebody can correct him. Yes.
Kalome.
Ke
It's
Pole.
because-
Ke Pole. Thank you.
Sir,
Yeah.
I have one question, but
Yes.
a bit outside the topic.
Yes. Yes.
If I ask the wrong question, sir, don't get mad, okay?
No, no, no. I don't get mad. See, we are here to learn together. Okay, Zamliani, go ahead, please.
Hi, sir.
If you have anything you want to ask, which you can, I'll just type my number. So you want to call and talk to me is also fine. I have 2 mobile number. You can both have WhatsApp. Yes, and as I said, now somebody create a group, add my 2 numbers, and then I'll add the head of the department's also number. Then we can share and talk also. I need all your batchmates to have another group of community medicine and add my numbers. Zamliani, you can call me when after 5 minutes. Okay.
Oh, hello. Hello, anyone? Can you hear me?
Yes,
Yes,
sir.
sir.
Yes, sir.
Yeah, I thought that you were
Yes,
having
sir.
class now to 1 to 2 p. No, 12 to 1.
Yes, sir.
It is supposed to be 12 to 1, no?
Yes, sir.
Yes, sir.
Yes,
Okay.
sir.
Let me talk to our Manoj sir. Why this class is not?
So this class is supposed to be taken by Dr. Rajesh.
Rajesh Rongpi, no? Yeah.
Yes, sir.
The topic is
Time
Time
management.
management.
Oh, let me confirm. Then, if he's not going to take, I'll take the next class. That
Yes, sir.
doctor's role in society. Just wait. Hello, good afternoon, sir. This student foundation course, not the class is supposed to be taken by Rajesh Rongpi, but he's not taking any class. So students are asking, what shall I do? Yeah, shall I take the next class, the next topic, that my topic? I think I can take. No, Rajesh Rongpi, I could not. Okay, okay. So let me feel. Yeah. Maybe he has some problem. Let me fill up this gap, and I'll start from now. Then within 45 minutes, I'll try to finish. Okay. Oh, hello. Good morning. I saw Vikas Beniwal. Vikas Beniwal.
Yes, sir.
Yeah. Can you hear me? Am I audible?
Yes, sir.
Vikas. Yeah. Please wave your hand. Okay.
What, sir?
You are from which state?
Sir, I am from Delhi.
Delhi. So you are attending from Delhi now.
Hello.
Yeah. Hello. You are attending from home, no? Now.
Yes, sir.
Okay. Welcome. Zamliani, can you hear me?
Yes, sir.
Okay, Zamliani, welcome. And Ruthi.
Thank you, sir.
Ruthi. Okay, Sarah.
Yes, sir.
Can you unmute yourself and respond?
Yes, sir.
Okay. Now my topic is that doctor's role in society. Okay, it is supposed to be from 2 p.m. to 3 p.m. But since that time, this one Rajesh Rongpi seems to be having some problem, so I'll take on his class. So let me share the screen. Okay. Can you see the screen now?
Yes,
Yes,
sir.
sir.
Yes, sir.
Okay.
Yes, sir.
Hello once again. Good afternoon, everybody. And today's I'll be talking about the doctor's role in society. To begin with, let me have a brief self-introduction. See, I'm as you see this, I'm Dr. Sivanal Lua, MS, MBBS MS. This MBBS I joined in 1994. Then I passed out in 1999. Okay, some of you might have not yet born. And MS Master of Surgery, I joined in 2004 and I finished in 2007. Okay, so I joined this ZMC referral hospital, state referral hospital in 2014. 2014. Before the college was started, I joined here. Okay. Then after joining this medical college, I had undergone some trainings like fellowship, different fellowship years, to name a few. Some are Association of Indian Surgeon, some are Association of American Surgeon. Okay, American Academy of Surgery. So these are some diploma in minimal access laparoscopy. So I'm right now the associate professor in the Department of ZMC. So this surgery you are going to is a final year subject, but from the second year, that means third semester onward, you'll be having this surgery class, theory and clinical posting. But during this first year also, you may come to the ward for this early clinical exposure, maybe once every week or twice every month. So that is the new curriculum which we are going to discuss also. So our department is this. These are some of the faculty of this surgery. Professor Manihar Singh is our head of department right now, who is dean in charge of our college, and I'm the second one. And the third one is Dr. John, who is a super specialist. Okay, he is a super specialist. After finishing MBBS, he did diplomate in National Board Surgery, then Master of Urology, Pediatric Surgery. So we have actually we have two super specialists. The other one is Dr. Samuel Elroth Falasilo, who is a plastic surgeon. He is the only meso plastic surgeon, and who did his MS from RIMS Imphal and MCH from Guwahati. Dr. John, he did PG from Bangalore, okay, Bangalore College, and MCH from Guwahati. And Dr. Samuel Elroth, who did his MBBS and MS from Warda, so Telangana. No? Then diploma in minimal access surgery, then fellow of American College of Surgeons. And Dr. Arlal Chandama is our assistant professor who did MBBS in Jipmar Pondicherry, then MS in Safdarjung, New Delhi, very popular hospital. Then after that, he had undergone all these fellowships, fellowship in endoscopy, fellowship in laparoscopy, and minimal access surgery. And our senior resident, Dr. Jothan Sanga, he did his MBBS from Pondicherry, Jipmar, then MS from Chennai Madras Medical College, then fellowship. Dr. Lalfruit Luanga did MBBS and MS from RIMS Imphal. Then Venu Gopala Reddy, MBBS from Hyderabad, DNB from Civil Hospital Aizawl, and fellowship in laparoscopy, minimal access surgery from Shillong, I think. Then others, we have 6 MBBS teachers, junior residents, who had all passed MBBS, then done internship, then trained in our department. They can do emergency surgery and all the minor cases. So, and in the next few months, we are going to have this one more associate professor, one more assistant professor, and one more senior residents, and 2 more junior residents. So totally will be 20 faculties in the near future. So you see, this surgery is one of the biggest subject department in MBBS course. So that is for the introduction. So we are a mix of doctors, surgeons who pass out from different colleges, who had all the good experience that will be shared to you. So in one way, you are lucky to join our ZMC. So on behalf of surgery also, I welcome you all. So today's topic will be about the doctor's role in society and professionalism in our duty and relationship. See, if you see this one, Sarah, can you see this? Emily?
Yes, sir.
Yes, sir.
Yeah. Before we start, let's see where we are. We are a doctor. We are going to be a doctor in the next 5-6 years. In our healthcare system, who are the most important individuals. You can see who are in the center. The patients, our patients are in the center. They should be, everything we do, it should be good and benefit for the patient. So whatever we do. So doctors are just among one of those who help, like nurses.
Excuse me, sir. Your slide is still in page 1.
Page 1. Slide is not moving.
Yes, sir.
Oh, let me check. Then can you see this one?
Yes, sir.
Yes, sir.
Is the slide moving? Department of Surgery?
Yes, sir.
Yeah. And this is the third slide. This is what I'm talking about. Can you see this?
Yes, sir.
Yes, sir.
Okay. If you have any problem, any query, you just interrupt me. Okay. I'll try to. Can you see this one? The patient?
Yes, sir.
Yeah,
Yes,
yeah.
sir.
So doctors are one of those like a nurse, a technician, manager, health educators. We are all working together to help our patient, to cure our patient and a healthcare system. So we should know that patients are always in the center. Everything we do, it should be patient-oriented, client, patient-center. And here, as a doctor, you should be like you should be a good physician. It's not written here, but it should be you should be a good communicator. You should be a healer or a clinician. Then you should be a scholar, educator, a researcher, a planner, and health advocate. We'll try to discuss this one by one. So we start from 12:30 and we'll try to finish before 1:30. Okay. If you have any problem, just interrupt me, ask me, then we'll try to do. See, let's talk about this one. Role of doctors or Indian medical graduate, MBBS. Okay. This is what you are going to become in the next 5-6 years. So what are the roles of MBBS in Indian system? He should be a clinician, a good clinician. He should be a communicator. He should be a leader and a member of a team member. Then he should be a lifelong learner, and he should be a professional. If you can remember this one, at least these 5 points. C2, clinician and communicator, C2. Okay. L2 means leader and lifelong learner. Not only to become a leader, but also to be a member of a team. He should know. No? Then P is professional. So C2, L2, P, clinician, communicator, leader, lifelong learner, and professional. We'll try to discuss this one in detail. So we doctor works to increase the health of our patients. Not only includes treating, but also listening to their the patient's emotional stress and helping to alleviate their pain. Then society tends to hold doctors in a very high regard. It is true. Because of this, doctors have influence in many areas. So they should be very careful not to misuse the trust placed in them. So an ideal doctors want to become a doctor because they enjoy working with the people and they find the medicine very interesting. And there are many more jobs in which you would get to work with people, and being a doctor is one of them. So an ideal doctors want to help people because he thinks that most people want to help others and accomplish it. For example, the scientist may discover a new medicine that cure many more people, and a politician may negotiate a peace treaty that save millions of lives. Certainly, no typical doctor could see 1 million patients in his lifetime. So as I have said, the role of Indian medical graduates. And when we talk about the professionalism, it is all related to that attitude and behavior that serve to maintain patient's interest above physician interest. So it is always patient-centered. Patients are the most important person. Then competence, you'll be coming to know this term competency many times. This means that it is a habitual and judicious use of our knowledge, our skills, our
Excuse me,
values.
sir.
Yes.
Sorry, your page is still in the fourth.
Sorry, I have to check again. It's still this one. Can you see this?
Yes, sir. It's moving.
Role of doctors. Now
Yes, sir.
I'll go to the next. Can you see this one? Professionalism.
Yes,
Yes.
sir.
Yes, sir.
Okay.
Yes, sir.
Then what is professionalism about? Can you see this?
Yes, sir.
Yes, sir.
Yeah. To be a professional, to be a good professional, you have to be this one, accountable, reliable, excellence, duty, honor, integrity, and respect others. And undesirable conducts are like those abuse of power, bias, or unfair to someone. Then sexual harassment, breach of all these things are desirable and undesirable behavior to be a good professional. Can you see this in our career?
No, sir.
Don't see again. So, can you see? Can you read this?
Yes, sir.
Yes, sir.
Yeah. So in our career, we'll encounter all kinds of people. Some of them will make you angry, but it will be a very important not to judge them and to remain compassionate. It will be our job to help them as well. So I hope that you'll find enjoyment in our work as a doctor. That's my good wish. And now let's go to another slide. Can you see this?
Yes, sir.
Importance of
Yes, sir.
doctors in the society. As you know, it can be discussed in this few heading, like saving the lives of the patient. Of course, most of the doctors, they do with the grace of God and with the help of medicine and some instruments, they are saving the life of the patient. Then extending the life of the patient is another important role of a doctor, like some, especially those terminally ill patients like cancer or some chronic disease problem. They can give palliative care, means to relieve, to alleviate their pain, and holistic care means to care their to extend their life with a meaningful life. That is called holistic care. So palliation or palliative. So that's another role of doctors. And doctors conduct research, and through the study they come up with a new medicine, a new methods like that. They contribute to the society. And controlling the epidemics like SARS or dengue or even COVID-19, they are doing lots of research. Then new treatment come from the research. Then they control this pandemic and epidemic. So you can also discuss in this way the importance or role of doctors in society. Okay. Saving life, extending life, conducting research. So doctors can check the spread of such disease by creating awareness among the people. Now, can you see this one, the same slide which I have shown?
Yes, sir.
Because
Yes,
yeah, you
sir.
can see, no?
Yes, sir.
Yeah. See, this is the same, this one. Here what I want to show is the importance of the patient. We all work together with nurse, technician, manager. Doctor alone cannot work, no, cannot do. So you need all these supporting staff and manager also. So the Indian medical graduate regulation, which was previously used, was published in 1997, which I had no experience with this 1997 because our batch was 1994, so we didn't follow this curriculum. Okay, then things have changed. Then the current GMR, current graduate medical regulation came up. That is GMR 2019. Okay, so 2019 graduate medical regulation have come up with the goal. The goal of this IMG is competency-based education. So that competency means the holistic or the habitual use of this communication skill, knowledge, attitude, values, emotion to our daily practice, to the people and to the community being served. So all our knowledge, emotion, reasoning, and our communication skill we should use in our daily practice to the patient, to the community. That is the goal of this new Indian medical graduate this one 2019. So what is expected by the National Medical Commission? Earlier this is called Indian Medical Education, that is the apex body of Indian medical education, and the knowledge and skill the doctor should know about the diagnosis and treatment of the common disease, and when to refer, means timely referral of the patient, then how to find out the reason of common diseases, common health problems, and how to prevent this common health problem and how to control them. That is our aim. And we should have a skill necessary for physician to deal with patient and communicate effectively. So communication and health education. Then basic administrative skill of the healthcare is what our goal as a medical doctors. So I'll show this one again. After becoming a doctor, we should be, if possible, we should try to be a good clinician, a good communicator, a good leader or a member of a team, and we should be alive longer. It's endless learning. Then we should be professional. So we'll discuss one by one this. Can you see this one, the graph? That's,
Yes, sir.
yeah, Indian medical graduate. You can see, no?
Sir.
Okay. Who all are there? Let me, oh, sorry. Lal Tuong Liana. Yo, ma'am, Lal Tuong Liana.
Yes, sir.
Oh, in Muthayam.
Oh, Muthe, sir.
Oh, hey, he Indian medical graduate to be your role. More, your goal should be a good clinician, a good communicator, a good team leader and team member. You should be a lifelong learner. Until you die, you have to learn. Then professional. Mal Somthara. Somthara.
Yes, sir.
Oh, ilaw siya kasoy ka.
Yes, sir.
Slide mo tayo draw.
Afia try.
Afia draw Indian medical graduate. He after 5.5 years, you should be a good clinician, a good communicator, lifelong learner, leader. So not only this one clinician, you should know all this. So when you say a clinician means who understands and provide, okay, preventive, promotive, curative, prevention, promotion, curative, palliative, and holistic care with compassion, care of the patient from the disease. Then lifelong leader means leader and member of a healthcare team. It means the capabilities to collect, analyze, synthesize, and communicate health data appropriately. So being a leader, you should try to be able to do all these things. Then communicator with the patient, family, colleague, and community. So communication can be verbal and non-verbal. Okay, more than nearly half of these communication skills are non-verbal. That means without speaking, by sign language or body language or by facial expression or by the tune of your voice. So it's very important, and you should be a good listener also to be a good communicator. That's what they said. So you should communicate. You should be able to communicate freely, effectively to the patient, not only to the patient, to the family. Not only that, your colleague, other doctors, and the community or the society. Lalo, mami?
Yes, sir.
Oh, baby, lalrem moyi?
Yes, sir.
Okay. Imutayem slide.
Yes, sir.
Roles of Indian medical graduate, roles of a doctor or MBBS. We are discussing this one. And you should try to be a lifelong learner, continuous improvement of skill and knowledge, and professional who is committed to excellence, who is ethical, responsive, and accountable to the patient, not only to the patient, with the community and the profession, with the colleague. So these 5 roles of IMG, Indian medical graduate, you please try to remember. No, C2L2P. C means clinician, communicator. L means leader, lifelong learner. P means professional. Let me ask one of you. Laldu thana? Lo muem laldu thana?
Yes, sir.
Oh, ilo siem kasoy ka?
Yes, sir.
Han soy te C2L2P2.
Clinician,
Yes.
leader and member,
Yes.
communicator,
Yes. Another L.
patients,
P is
patients.
professional.
Oh, professional.
Let me ask another one. Silal rem kluanga. Silal rem kluanga mo.
Yes, sir.
Okay. Enge, what are the roles of doctors? IGM.
Communication
C2L2P.
well nature.
Huh? C2 kan, so it C2. Hello?
Sao có thể hiện lệ?
Clinician, communicator. Lal Triệt
Yes,
Pui.
sir.
Lal Triệt Pui.
Yes, sir.
Han soy VTL.
Leader and lifelong learner.
Okay, good. Lal Nun Limi.
Yes, sir.
Enge P ka?
Professional.
Professional. Okay. Vikas? Hello?
Yes, sir.
Oh, can you name those roles of Indian medical graduate, which I have just mentioned? C2L2P.
Yes, sir.
Yeah.
C for clinician
Yeah.
and C for clinician and C for communicator.
Yeah. Good.
L for a lifelong learner
Yes.
and L for leader or a teammate and P for professional.
Oh, good, good, good. So if you can become a good IMG, Indian medical graduate, these are the roles, what we ought to know. So what I'm just collecting this slide from internet. The doctors play a vital role in building the society. They are the lifelines of the community, and this term can be used very literally for the doctors who shape culture and shape those that are diseased and unhealthy. Doctors work hard to save the life of patient with serious ailment, and they act as an inspiration to society. Can you see the slide now?
Yes, sir. Yes, sir.
Okay. And here another role of medical ethics. Medical professions should have high status and reward because their job is so important to the society, and they have a very strong social commitment, like Hippocratic oaths. Recently, new things come up from the NMC that this Hippocratic oath may be replaced by Charak Sapat. No, Charak Sapat, which they call it, is a detailed version of this Hippocratic oath, Indian system, which we'll come to know later. Then the role of medical ethics and what is Sikh role, and we'll not go into detail all these things. Then doctors are not servant of their patients. They are traders like everyone else in a free society, and they should bear that title proudly, considering the crucial importance of the service they offer, that you find from Ayn Rand. Can you see this chart picture?
No, sir.
Sorry, your slide is not changed.
Okay. Can you see now?
Yes, sir.
Yes, sir.
See, medical expert. This medical expert should be, as you have said, a professional, a communicator, a collaborator, or a leader, and a scholar or a lifelong learner, which you said, then a manager or a team leader. Okay, so these are the importance of medical expert. Okay, so to be a good clinician, you should know the right. You should have a good physical examination. You should give a right treatment. You should have a lot of good knowledge. Expert then takes all the information and no repetitive mistake. Means mistake may happen, but you should not repeat the mistake. You should learn from a mistake like that. So it is a good chart which I've collected from the internet, and these are some roles of the medical expert or the doctors in detail. See another. Can you see this? Medical expert. Can you see this? Is my
No,
slide
sir.
moving?
No,
No,
sir.
sir.
No. That's a problem. No? So these are the detail. As a medical expert, you should have all the doctor's role. Then as a communicator, you should have a good patient doctor-patient relationship. Then effective patient and physical communication is very important, and they said it is equivalent to prescribing a medicine. No? So as I have said, this good communicator can help the patient without giving a drugs also. So the non-verbal communication is very important. Should be a good listener, and if you know how to break a bad news, you should communicate direct or in a compassionate way that will help the patient and strengthen their therapeutic relationship. So as a communicator, you listen effectively, and you ask information and provide information, counseling of the patient, then inform consents. So role of a doctors as a communicator, I have given in detail, and to build a good rapport with the patient, then convey a relevant information, then develop a common understanding. All these things are the qualities of a good physician. Then collaborator, to work as a team, like a team member, or a team leader. So as a physician or a doctor, you should have a good working environment, a good partnership with others at different levels, like it may be with the patient or with the patient relative or with your colleague, your care team or other doctors. Then those technicians and all the departments, you should collaborate together. Means you should have that leadership quality, no? Or a team member. Can you see the slide now?
Yes.
Yes, sir.
Yes, sir.
So to be a good leader and manager, these are the important points. Making a decision about the resources and contributing to the effectiveness of the healthcare system.
Yes, sir.
Oh, ilaw NM.
Yes, sir.
Okay. So to become a good doctor, you need to have to have all these qualities, and you have to be a good advocate, and you should be as a researcher or a scholar or a lifelong learner. Okay. Tunga midang kala cậu sửa lậu tunga om châu. Mal som tharam nari omem. Mal som tharamar.
Yes, sir.
Oh, ilaw ngay thamo.
Oh, ngay thầy.
John, as a doctor, you have duties. Duties to the patient and duties to the colleague, duties to the community. All these things are duties, and I'll not go into the detail to save times. So duties of physician. A physician shall recognize his important role in educating the public. Okay, he should certify only that he has personally verified. He should strive to use healthcare resources and seek appropriate care and attention. And he should respect the local and national code of ethics. Physicians should respect this. Then this is about the professionalism, and you have a duty towards the patient. Of course, this you know, patient's privacy. You should give proper comprehensive care and inform about the patient condition, then protect the patient interest and keep the patient secret. Confidentiality you have to maintain. So what is our duty as a doctor towards the patient? That is listen carefully to the patient complaint, or sympathize or empathize with in his suffering, and you should respect patient's opinion. Then you should treat all the patient equally without any bias. Then you should fear God when dealing with the patient. So respect the patient's religious belief and tradition. Okay. Then you should ask only the tests needed for the patient. Then you should honestly explain to the patient about the illness, and you should not hesitate to refer the patient to other doctors, to the colleague, other experienced doctor. So timely referral, when to referral is very important, because a single doctor cannot know everything. So at that time, you should not hesitate to refer to the other better or experienced doctors. Then emergency care, we should continue to give. In case of emergencies, doctors should give a proper care to the patient, and you should continue to extend a proper care and relieve the patient pain, relieving the patient pain. Then our roles toward society can be, let's wait before that. Lal du sa kamol chin here memo.
Yes, sir.
Okay. What are the roles of Indian medical graduate? Dusak.
Yes, sir.
Can you name the 5 roles of Indian medical graduate?
Yes, sir.
Please.
Clinician and good communicator.
Yes. Good.
Live lifelong learner and
Mm.
leader or teammates,
Yes.
and a good professional.
That's good. Exactly. Thank you. Thank you, Lal Dusaka.
Thank you, sir.
So you can also discuss like this. The doctor should have a positive interaction with the community affairs, and the doctors should protect the community by reporting or reportable epidemic disease. So like communicable disease, like COVID, for example, if you should report by protecting the community. Improve the health of the community through health education and involving in the community health activities. These are all the roles of doctors toward the society, and we should use the rational we should have a rational use of healthcare institution and resources. Our instruments, our medicine supplies, we should use judiciously. We should have rationally, I mean to say. Then effective contribution to the development of policy. We should contribute, we should help the government also to implement the policies, the health in the health system. Then doctors try to be a role as a role model in his attitude and religion, and should try to promote the health equity among the society members, and should maintain the health resources and ideal utilization of the such resources. And doctors should use his skill, knowledge, and expertise to improve the standard and quality of health services rendered to the society. These are all, as a doctor, our role towards the community. Ruthi lang mga isoli, ma'am.
Yes, sir.
Okay. Can you read this in the slide? Doctor's role toward community.
Yes, sir.
Please read.
To best a role model in his or her attitude and religion.
Okay. Number 2.
Promotion of equity among society members.
Thank you. Number 3.
Maintenance of resources and the ideal utilizations of such resources.
Yes. Then the last one.
Use skills, knowledge, and expertise to improve the standards and quality of health service rendered to the society.
Yes. All these are our role toward the community. Vanal Suangyo, ma'am.
Yes, sir.
Can you see this slide?
It's still the same slide.
Okay. Let me check. Now, can you see this, doctor's right?
Yes, sir.
Okay. Please read only this bold letter.
Receive his or her complete right. Chances to continue education. A setup within which he or she can provide health care.
Thank you. Thank you. Manal Sungi Lal Nun Limi, ma'am.
Yes, sir.
Can you see the slide?
Yes, sir.
Can you read only the bold one?
Yes, sir.
Please
Not
read up.
not to be court, not to be suspended or held, defend him or himself or herself.
Okay, thank you. Physician duty towards the colleague. Silal Remtluang, ma'am.
Yes, sir.
Okay, can you read the bold one, the bold part only?
Sir. To deal
good and act towards his colleagues in a good manner, to avoid
Okay.
direct criticism to his colleague, not to
Yes.
indulge in defaming,
Yes.
to exert every possible effort.
That is our duties toward our colleague. Lalming Moi,
Yes, sir.
can you read some
Yes, sir.
all the lines? Can you read all the lines?
Yes, sir.
Please.
Respect the differences with colleagues, sex, culture, belief. The physician should respect other non-physician medical profession colleagues and appreciate their roles in healthcare of the patient. He or she must report the incidents in which a colleague could be dangerous to the authority concerned.
Thank you.
Thank you, sir.
Now, Sarah.
Yes,
Sarah
sir.
Masongkimi, can you read this?
Yes, sir.
Please.
Respect the owner of the profession. Develop him or herself to develop the profession through CME research and publications. Adhere to the standards of practice, GCP, EBM,
Thank you,
guidelines,
thank you.
etc.
Those are the rules. Now, laldu thana kanzoto. Kanzoto em laldu thana ka?
Yes, sir.
Yes, can you read this? Doctor's duty toward his profession.
Abstain from any behavior or actions that would question his or her credibility or establish dishonest affairs with patients or their families.
Yes.
So am I going to continue?
Yeah, please.
Avoid the request of fame on the account of professional ethics and standards, to provide role model for his colleagues and patients.
Thank you.
Yes, sir.
Now, may I call Emily Ezorempuyi?
Yes, sir.
Can you read this? Doctor's duty toward his profession.
Reflect sincere devotion and dedication to the medical profession, to avoid any action that could lead to contempt of the medical profession, and to maintain the standards of medical profession, to contribute in the development of the profession through research and continuous learning.
Thank you, thank you. Baby
Thank you, sir.
Lalremoyi.
Yes, sir.
Please read these 2 lines.
Doctor's duties towards his or her profession. The physician should refrain when dealing with the patient from any act or conduct that would infringe his honesty and integrity, to avoid seeking fame at the expense of the profession ethics and principles.
Thank you. So,
Thank you, sir.
all those doctor's duty toward the patient, toward the colleagues, toward the profession, toward the society or the community. So, as a doctor in your career, you are going to encounter all kinds of people. Okay, some of them will make you angry, but it will be very important not to judge them, and it is important to remain compassionate. It will be our job to help them, helping the patient, helping the needy, the society, helping the others. So I hope this fine enjoyment in our work as a doctor. Let's Rembrot fella chakchu ako ma'am. Rembrot fella.
Yes, sir.
Cheer thayame and cheer tele.
Medicine cures diseases, but only doctor can cure patient.
So,
Carl Jung.
What does it mean? What could be that mean? Medicine cure the disease, but the doctors cure the patient. So these have very, I think, very good meaning. You should treat the patient, not the disease. That's what they used to say, no? So that's to become a good doctor. So anyway, you prescribe medicine. That's the importance of communication, no? Verbal communication or non-verbal communication. The patients should trust in you, have confidence in you. Otherwise, the medicine you prescribe or the advice you give may not work. So that's, I think that's the meaning of this one. Medicine cure the disease, but the doctors can cure the patient. Let's see other. Lalom bon lal suami câu tố Okay. May I call to Sida Baidia? How are you?
Yes, sir.
Are you
I'm
there?
good, sir.
Mm.
Yes, sir, I'm here.
Yeah. Where are you from?
I'm basically from Assam, but staying in Mizoram.
You are now in Mizoram.
Yes, sir.
Okay. Can you read out this one,
Yes, sir.
please?
The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet and in the cause and prevention of disease. By Thomas
Yes.
Edison.
Thomas Edison. Thank you. Let's see another slide. Are you feeling bored now? Shall we stop now? PC
No, sir.
Lalompuya. Ramtarhaki, PC Lalompuya.
Yes, sir.
Ining to em.
Những lỗi
45 minutes to continue. So to sum up our today's topic, these are the physicians or doctors' role in the society. Okay, in relation to the human rights or social justice, health and culture, allocation of resources, then drugs and medical mission, all these things. And in case of like pandemic or epidemic or catastrophes, any mass casualties and may come up, and some communicable disease like this COVID or SARS or whatever. So the doctors have a very important role in the society. As we have said, besides saving the life of the patient and extending the life of the patient by doing a palliative care or holistic care, and then controlling the epidemic or the pandemic, that's also the role of doctors in the society. And then doing a research. From the research, many things come up, treatment option, then all these scientific medical science developed from the evidence base through the research and study only. So these are the roles of the doctors. So to conclude, let's remind you the same slide. Ngur Shailavi, ma'am.
Yes, sir.
Ngur Shailavi. Oh, ilaw ngay sa vetero.
Oh, my Thai.
Okay. Can you repeat those roles of IMG?
C2, L2P, clinician, communicator, leader, and team member, lifelong learner, and professional.
Good. Lazar Liani?
Yes, sir.
Ilaw ngay sa VM nang.
Oo ngay ta.
Yes, sir.
Do you listen those rules of Indian medical doctors?
Yes, sir.
Ashish Chauhan. Okay, Ashish Chauhan.
Yes, sir.
Where are you, Ashish?
I'm currently in Aizawl.
Oh, you are from which state?
I'm from Uttar Pradesh.
From All India quota or?
No, sir. I studied in Aizawl, so from state quota.
Oh, from state quota. Okay. Mizo trong poi thiam. Tro.
Oh, thiame.
Can you see the slide? This?
Yes, sir.
Can you read it?
National Doctors Day is an annual observation on the 1st of July.
First July of every year is a Doctor's Day. Okay, you should remember this. Okay, please continue.
For saluting the life-saving efforts of doctors, annually we celebrate this day. In the Indian society, doctors are said next to God. The statement justifies the role of doctors in our society. medicos are needed to be thanked for.
Okay, thank you. Anything you want to add or you want to suggest, you want to ask, any queries from all of you? Or do you learn something from my session?
Yes, sir.
All your
Sir.
MBBS course will be based on competency. Okay, competency based. That you will be. They will explain you more. I don't have much deep experience about this, as we are as I'm a surgeon. I'm a surgeon, and so from your third semester, you will be coming to our department, clinical department, lecture plus clinical posting till 9th semester. So from 3rd to 9th semester, that means 7 semester, 3.5 years, you'll be having surgery as one of your subject. So I wish you all the best, and I welcome you all to the ZMC. This ZMC in local kan lom tak zetani. Thank you for your kind patience. Thank you all.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you,
sir.
Thank you, sir.
I think that will finish today's program. So 2 to 3 topic we have finished now. Okay. So
Students, yeah.
you are free for today.
Just wrong thing, and can't even think lem lo tro. The can't
You think lawa lawa 12:30 kan luchin kat tu man om si lawa mano sa ka phone mo.
Students, that means 2 to 3 class will be cancelled. The class which you've just finished is to be started from 2, and you have that means the class from 2 to 3 will be cancelled.
Okay. That means that finish your today's class.
Yes, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you,
Thank you,
sir.
sir.
Thank you.
Thank you, sir.